PCH Test. Please answer the test questions to the best of your ability. They will be matching, true, false, and multiple choice. You will only receive one attempt to take the test. Once you start the test, you must complete it. Question 1. The first step in the decision-making model is to identify the decision that needs to be made. True or false? Question 2. One organ, eye, and tissue donor can help save lives and improve the lives of as many as 30 individuals, as well as ease the pain and suffering of many others. True or false? Question 3. Primary prevention involves early detection such as medical exams and self-examinations. True or false? Question 4. First aid for bleeding includes wearing protective equipment, applying firm pressure over the bleeding area with gauze and clean cloth. If the bleeding doesn't stop, you should remove the first dressing and add a second dressing and press harder. True or false? Question 5. PRICE stands for Protect, Rest, Ice, Cold, and Elevate. True or false? Question 6. Cancer is the uncontrollable growth of abnormal cells. True or false? Question 7. The first stage of REM sleep, active sleep where dreams occur and eyes move back and forth under eyelids. True or false? Question 8. Primary prevention includes eating nutritiously, exercising regularly, and avoiding harmful substances such as tobacco. True or false? Question 9. All of the following organs and tissues can be donated for transplantation except kidneys, small intestine, large intestine, or corneas of your eyes. Question 10. If you decide to become a donor, you should let your family know your wishes, say yes to the donation when you get your driver's license at the DMV, register at donatelifenc.org, or all answer choices. Question 11. Which of the following would be considered a tertiary control of diseases? Chemotherapy, breast self-examinations, having blood cholesterol checked, or testicular self-examinations? Question 12. A condition in which there is a progressive loss of bone tissue. Osteoporosis, cardiovascular disease, bronchitis, hypertension. Question 13. Hypertension and arteriosclerosis are both characterized as what type of chronic disease? Cancer, emphysema, heart attack, cardiovascular disease. Question 14. The most deadly of the three types of cancer, causing more than 75% of skin cancer death, but accounting for less than 5% of skin cancer cases, are malignant melanoma, basal cell carcinoma, carcinoma, or squamous cell carcinoma. Question 15. When detecting atypical melanoma moles, it's important to pay close attention to the ABCDs of melanoma. What does the B stand for? Border, big, broad, benign. Question 16. When detecting atypical... Question 17. Wait, we have the question. 16. When detecting atypical melanoma moles, it's important to pay close attention to the ABCDs of melanoma. The D stands for what? Diameter, depth, dimension, diangle. Question 17. All of the following characteristics that increase an individual's risk for melanoma except fair skin, being male, light hair color, heredity. Question 18. Which of the following would be considered the most reliable and credible website? www.cancer.org, www.heartdisease.org, www.redcross.net, or www.stickfix.com. Question 19. When riding an ATV or motorcycle, all of the following should be worn except long sleeve shirts and pants, DOT approved helmets, tennis shoes, eye protection. Question 20. Annual physical examinations is an example of what type of disease control? Primary prevention, secondary control of disease, tertiary control of disease, all of the above. Question 21. A chronic disease where there is an accumulation of plaque on artery walls is blank. This typically is caused by unhealthy food choices that are high in saturated fat and cholesterol. Cancer, hypertension, bronchitis, arteriosclerosis. Question 22. The final stage of the sleep cycle where active dreams occur, breathing and heart rate increases and becomes irregular, muscles relax, and eyes move back and forth under the eyelids. Sleep stage 1, sleep stage 2, REM sleep, non-REM sleep. Question 23. The most frequently diagnosed skin cancer, 2.8 million every year in the U.S., that rarely results in death and the most often occurs in heavily sun-exposed area of the skin. Basal cell carcinoma, squamous cell carcinoma, fraternal cell carcinoma, or carcinoma. Question 24. Possible health result of body piercings include bloodborne diseases, scars, keloids, all answer choices. 25. Moving a victim is dangerous and seriously injured victim. A victim should only be moved if the scene is unsafe, the victim has a loss of feeling in their legs, the victim has a fracture, or the victim has a loss of feeling in their legs.